as a gastroenterologist, I always recommend to people, if you see blood in your stool, please talk to your doctor about that. Don't assume it's hemorrhoids. Even if you think it's hemorrhoids, even if you're 99% sure that it's hemorrhoids, don't make that assumption, because we are seeing a lot of cases of young onset colorectal cancer. So these are young people in their 30s, 20s, being diagnosed with colorectal cancer.
Wow.
And rectal bleeding is one of the main symptoms of colorectal cancer. Hemorrhoids can be irritating, bothersome, sometimes a little bit of pain, but if I'm feeling a lot of pain and I'm very uncomfortable, I think that's a good reason to see a doctor, because it may be that you have a thrombosed external hemorrhoid, which can be treated and relieved from the pain if you get care early enough. Or you might have something else called an anal fissure, which is a completely different condition and needs to be treated differently.
So on a scale of 1 to 10, if I'm just kind of a little uncomfortable down there to like, whoa, my butt's on fire.
Yeah. And people describe anal fissure as pooping glass.
Oh.
So if you're feeling that pooping glass feeling, that's not normal. That's not a hemorrhoid, or less likely to be a hemorrhoid.
Going back to the blood in the stool thing, the first time that
Do you have blood in your stool? Is that why you're nervous?
I will tell you, the first time that I ever had hemorrhoids was when I was maybe 24. I was at a work event in Park City, and it had been a long week of quote unquote work, which involved a lot of drinking and partying and other kind of extracurricular activities. And I snuck into a bathroom at a party and went poop at this party. And I looked down into a toilet, and it wasn't just a drop of blood. It looked like the whole toilet was filled with blood. First thing I did is I called my mother. And I called my mother from, on my mobile phone at this party. And my mother got her friend Sherry Rettinger on the phone, and whose husband is our family.
Jewish nervous mothers.
Jewish nervous mothers. And they said, it's probably a hemorrhoid, although it might look like a lot of blood. That's kind of what happens. Tell me a little bit more about that. If you see blood just on your toilet paper, is that potentially less of a concern than maybe seeing actual blood in the toilet? And is that any sort of a indicator as to the severity of the symptoms and therefore what to do next?
I always tell people that even if you see blood, whether it's a little bit or a lot, you can't predict whether it's a hemorrhoid, because I've seen patients and they've told me the story. They're like, it's just a little bit of blood when I wipe. And then it turns out they have a large rectal precancerous polyp that's bleeding. And that can cause little bits of blood. And I've seen people with the toilet bowl fills with blood, and it was like a bloody murder scene. And it's just the hemorrhoid that was like very aggressively bleeding, but no concern for cancer there. So it's hard to use the predictions and,
So when in doubt, take a picture of my toilet bowl and send it to Dr. Wendi, and you will tell us whether or not it's something to be concerned about.
I don't give individual medical advice over the internet.
Got it.
So don't send me your pictures. Although I do have a lot of friends and family members and patients who do show me pictures of poop and the toilet bowl.
Going back to when you said that seeing blood in the toilet is when you go to a doctor, our products are designed to help for each step of the way up until that point.
Yes, and also after that point, because I think often people will go see a doctor, they get their colonoscopy, which I assume at some point you did get a colonoscopy.
I did
because I forced him on his 40th birthday.
My wife's gift to me on my 40th birthday, which she happened to be actually traveling in Europe during, was a colonoscopy. The experience was not so bad. So we'll have another conversation all about that. And it did give me a certain amount of reassurance, because although I've struggled and had hemorrhoids for a long time, I never really knew if there were, other kind of more upstream issues that maybe were either causing the symptoms of the hemorrhoids or perhaps were related.
So if you're having blood in your stool, it does not matter what age you are, you should get a colonoscopy to get checked out, because you want to exclude things like cancer, a precancerous polyp, inflammatory bowel disease, which is a whole separate conversation, or you want to confirm that it's hemorrhoids. And the main goal of the colonoscopy is to exclude these other scary things that need to be treated, and then to diagnose, okay, you have hemorrhoids. I think
So you're lucky if it turns out that you have hemorrhoids.
Exactly, because that's the least scary of all those things.
Got it.
And then if you do get diagnosed with hemorrhoids, I think that's where a lot of people then get stuck, and that's where norms would come in.